I have provided privacy for my patient by closing the doors in the room. Hi, my name's Nicole and I'm an Oakland University nursing student. I'm going to be your nurse for today. What's your name?
Molly.
Hi Molly, nice to meet you. How are you?
I'm good.
Good. So the purpose of today's assessment is to examine your overall hair, skin, and nails, eyes, ears, nose, neck, mouth, and face. It's going to take about 15 minutes. So I'm just going to start by washing my hands and asking you a few questions. So Molly, can you tell me if you have any history of skin disease or skin cancer?
No.
Okay, that's good. And when was your last eye examination?
About a year ago.
Okay, do you have any contacts or glasses?
No.
And any problems with your hearing loss at all?
No.
Okay, changes in your skin, like changes in moles, itchiness, or rashing occurring?
No.
Good. Any hair loss?
No.
Or changes in your nails at all?
No.
Okay, good. Do you have any headaches, dizziness, or neck pain?
No.
Okay, and any changes in your vision, ear pain, or nasal discharge?
No.
Perfect. So I can now move on to the general survey of my patient. So can you tell me how old you are, Molly?
15.
And what gender do you identify with?
Female.
So Molly is a 15-year-old female. And can you tell me today's date?
January 31st.
And what is the time?
2:30.
And where are you right now?
My house.
And why are you here today?
For a checkup.
Okay, so my patient has answered 4 out of 4 questions correctly, so therefore I can note their level of consciousness as alert and aware times 4. And as I look at the face, I can see that she has a fair skin tone with a pink and neutral undertone. I also see no lesions present, and I see some macules on the cheeks and no pustules present. Her facial features also seem to be relaxed and her speech is clear and articulate. And I see that the face and body is symmetrical. And I also see my patient is dressed appropriately. There's no body odors. Her hygiene appears to be well kept. And I do not notice any physical deformities as well. So I can now move on to the inspection of the head and the hair. So I see that the head is midline to the body and there is an average size and oval shape. Do you mind if I go ahead and touch your head a little bit and feel around?
No.
Okay, I'm just gonna look around. Okay, do you feel any pain or tenderness as I touch the head?
No.
Okay, I can note that Molly has no pain or tenderness to the head. And I can also see that her hair is a dirty blonde color, is straight and it is shiny. I'm going to look at the back a little bit and the scalp. Okay, I see a normal and even distribution, so everything seems to appear good there. I'm now going to move on to the face, and as I mentioned previously, she has a fair skin tone with a pink neutral undertone. It also appears to be symmetrical, and I see minor macules on the cheeks, no pustules, no lesions present, and I also note no abnormal facial movements. So I'm now going to look at the eyes, and I see that they are brown and symmetrical on both sides. I also see that the eyebrows appear to be fully present and are also symmetrical. There are no lesions present. And you can go ahead and close your eyes for me. Okay, my patient's eyelids close completely, so I can note full approximation of the eyelids. And I also see that the skin color of the eyelids matches the rest of the face, and everything appears to be a normal color there, and no edema or lesions on the eye as well. You can go ahead and open your eyes for me. I'm going to look at your eyelashes, and I see that they are fully present with an even distribution on each side. And I see the projection of the upper eyelids goes up and outward, and the lower eyelids goes down and outward. Okay, I also see that your eyes are centrally aligned in the eye socket, and you have a white sclera. Can you go ahead and pull your eye down like this for me? Okay, looking at the conjunctiva, I see that it is pink and healthy. Everything appears to look good there. So we can now move on to the ear. Do you experience any earaches, hearing loss, or tinnitus, which is ringing of the ears?
No.
Okay, good. And do you mind if I just take a look at your ears?
No.
Okay, I'm just going to move your hair. Okay. I see that they are both proportional to the face, and I see a C shape with a normal size and normal color. So I can note that my patient's skin condition of the ear is normal, no dryness or scaling occurring. And I'm just going to go ahead and feel the pinna, the top of each ear. And I feel that it is flexible. Do you feel any pain or tenderness as I touch?
No.
And down to the earlobe. Any pain or tenderness there?
No.
Okay, and then the tragus on both sides as well. Any pain or tenderness there?
No.
Okay, good. I can now move on to your nose. So do you experience any frequent nasal discharge, colds, or frequent nosebleeds?
No.
Okay, good. And looking at the external nose, I also see that it is midline to her face and symmetrical. There are no lesions present and no drainage. So can you go ahead and close one nostril and breathe in and then breathe out for me? Good, and other side. Good. So my patient has full patency of both the left and right nostrils. So I can now move on to your mouth. So do you experience any sores or toothaches?
No.
And any difficulty swallowing at all?
No.
Okay, perfect. I'm now going to use a tongue blade and pen light, and I will first inspect the teeth. So go ahead and relax your lips and keep your teeth closed. Okay, I see that Molly has straight white teeth in a healthy condition. You can go ahead and open your mouth for me. Okay, I see no dental caries as I look around. And I also see that the gums on the top and bottom appear to be a healthy pink color. There's no edema or lesions present there. So you can go ahead and stick your tongue out for me. Okay, and I see that it is midline to the patient's mouth. It is a pinkish color on the dorsal side. There's normal papillae, and it appears to be moisturized. You can go ahead and take it to the roof of your mouth. Okay, the ventral surface also appears to be pink, and the frenulum looks healthy. You can go ahead and put your tongue back down. I'm just going to look at the inner parts of your cheeks. So looking at the inner buccal mucosa of both sides of her cheeks, I see that it is pink and healthy, and there are no evident lesions. Okay, so everything looks good there. I'm just going to go ahead and wash my hands. Okay, so we can now move on to the neck. So do you have any neck pain or difficulty moving your neck around at all?
No.
And any lumps or swelling?
No.
Okay, good. I'm just going to inspect the neck, and I can see that it is midline to your body and your head, and it is also symmetrical. Do you mind if I feel around your neck?
No.
Okay, so I feel that the trachea is midline, and I will now feel for abnormalities in the lymph nodes, starting at the pre-auricular lymph nodes and post-auricular, okay, submandibular and submental, and then the anterior cervical and posterior cervical. Okay, so I can note that I was unable to find any abnormalities in her lymph nodes. So I am now going to assess your range of motion. So can you go ahead and bring your chin to your chest for me? Okay, good. And your head all the way back. Good. And look left for me. Go ahead and look right for me. And then bring your ear to your left shoulder. Good. And your ear to your right shoulder. Did you experience any pain as you were doing that?
No.
Okay, good. So I can note that my patient has no pain or tenderness reported in the neck. I am now going to test my patient's skin trigger. I'm just going to move your hair a little bit and your shirt so I can pinch the clavicle skin. Okay, and I see that the skin goes back to normal in less than 3 seconds. So therefore, my patient is normal and hydrated. And I will now look at your nails. So can I see your hands?
Yeah.
Okay. I see that they are a normal rounded shape, and there is a flat contour, and they're consistent and uniform in color. It is free of discoloration. Okay, I'm gonna look at the nail bed. Okay, and I see that it is less than 160 degrees, so I can note a negative profile sign. And I'm just gonna test the capillary refill. And I noticed that, I'm going to check the other side as well. I noticed that her nail goes back to normal in 2 seconds. So I can note that she has sufficient blood flow in both hands because the refill takes less than 3 seconds. So we have completed the exam for today. Do you have any questions for me?
No.
Okay, I will now wash my hands. And if you have any questions, feel free to call. I hope you have a great day. And thank you for your time and patience.
Thank you.